Here we see rectus abdominis with its associated trigger points. First, we're going to talk about the two trigger points on the right belly of rectus abdominis. Those are going to be the most proximal and distal trigger points. Those two have strong association with low back and mid back referral. Obviously, the trigger point closest to the pubic bone will have association into the low back, and the one closest to the xiphoid process will have contribution into the mid back just below the inferior angle of the scapula. On the left side, we see two very close trigger points right around and below the umbilical area, with trigger point referrals both into the midline around the belly button of the stomach itself, as well as the anterior and deep iliac crest. In our next video, we see the fibers of both the internal and external obliques. The external obliques are going to be in red, the internal in blue. And we can see the trigger points for both of those tissues are what's called overlapping. So we don't distinguish the trigger points of either obliques from each other. The location of the referral plane and the trigger points are the same, right under the costal margin near the xiphoid process, as well as a pair of trigger points along the iliac crest attachments. The location of the referral is going to be into the lower abdominal quadrant and into what will often be described as the area of the groin, with some spillover pain up into the lateral abdominal wall. Next, we have transverse abdominis with its horizontal fibers wrapping around the abdominal wall like a corset. It has a single trigger point underneath the costal margin and above the belly button, right in between the two. And its location of referral pain is going to be like a tripod underneath the xiphoid process and along the costal margins. Sometimes this is referred to as the belch point, as trigger points here have been rarely but occasionally suggested as a point that would create a belch or a burp. Lastly, here we have psoas and iliacus, with psoas presenting trigger point referrals both in the belly of the muscle around L3, as well as into the belly towards the attachment on the lesser trochanter, and iliacus presenting with trigger points both at the attachment site in the lesser trochanter and along the anterior and proximal inner surface of the iliac crest. The location of the trigger point for these muscles is shared and can either show up in the area of the growing and upper medial thigh, and more commonly into the lower back, ipsilaterally, meaning it will appear on the right or the left side, along the lamina groove and slightly into the thoracolumbar fascia.